In New York, another milestone. 2,000 cases in one day for the first time in 5 long months. And the doctors tell us it's about to get much worse. Everyone on earth is waiting for a vaccine to cure what ails everyone and return us to something like normal. But what if that never happens? Hear me now. There's a British scientist who's now reporting COVID is likely to become not a pandemic, but an endemic. In other words, something that comes back every year for years and years and years, something we'll have to just deal with, like the flu. Dr. Amish Adalja is with us. He's a senior scholar at Johns Hopkins Center for Health Security. Doctor, you raised this possibility of coronavirus as an endemic, a recurring thing like flu back in February. Are you now convinced, or where are we?
I am pretty convinced that this is going to be something that we're going to have to contend with for years to come. It will be something that we sort of defang with treatments, with a vaccine that probably prevents you from getting severe disease. But it is going to be something that was probably going to follow the pattern of the other 4 seasonal coronaviruses that cause 15 to 25% of our colds every year.
And we just deal with it and ad infinitum, and do we continue with masks and just sort of move on in a different way? Does our economy figure out a way to recover? I mean, there's a lot here.
I do think what's going to happen over time is what people are going to have is a change in risk perception. We're going to have new treatments. We're going to have a vaccine that maybe doesn't prevent you from getting infected, but prevents you from getting hospitalized. And I think that will get the public health urgency off of this over time. I think for the first year to 2 years, we are going to be probably aggressive. People are still going to be advocating some degree of social distancing and face coverings. But over time, with new treatments, it is going to be something that becomes more like influenza. And maybe we'll get a second-generation vaccine that'll be more like a measles vaccine and can drive it down to a low level. But I think we have to look at the pattern of coronaviruses and how they've established themselves in the human population and really think about endemicity becoming something, but with a lower virulence level, because we are getting better every day at treating this infection.
We are getting better, thankfully. Dr. Amish Adalja, thank you so much. Shepard Smith here. Thanks for watching CNBC on YouTube.